We actually have been able to find some of the mechanisms by which exercise helps. When we exercise, we know that on one hand, the insulin resistance is counteracted, but there's another one, rather fascinating. Good morning, my friend, on day 8 of my 77 days challenge of biking to work. Let's acknowledge this walker. Wonderful. Today I'm going to talk to you about exercise and diabetes. I'm a primary care physician, and every day I see at least a half a dozen people with diabetes or more, usually type 2 diabetes. And I remember about 20 years ago when I was in training, in residency, a landmark study had come out in diabetes prevention. It was looking at people with no diabetes or people with prediabetes, and they tried to tease out what are some of the things that help prevent diabetes from occurring in these groups. And what they found out was that diet, a healthy Mediterranean style diet, high in plant foods, high in fiber, low in simple carbohydrates and low in fat, was the best. But they also found that exercise is crucial. People who exercise regularly develop prediabetes or progress from prediabetes to diabetes much less frequently than people who didn't exercise. And that finding has remained true since. In fact, the evidence of the protective effect of exercise against prediabetes and diabetes has only strengthened since then. And we actually have been able to find some of the mechanisms by which exercise helps. And one of them is actually quite fascinating. See, when we eat food and carbohydrates, and they are digested in through glucose. Glucose gets absorbed in the intestine, and then through the bloodstream goes to the liver and muscle, and everywhere else is needed. Glucose cannot penetrate into the cell freely like through diffusion. The cell is typically impermeable to glucose. And we have actually some specialized cellular machines, molecular machines, they are called glucose transporters, that float around in the cell cytoplasm. But when we eat food and we absorb glucose, our body senses that, secretes insulin in the pancreas, and insulin goes throughout the body in the postprandial state, in the period after we eat, at an increased rate, and binds on the insulin receptors on these cells. And it is the subsequent cascade of molecular reactions and events that actually activates, through this insulin pathway, the glucose transporters to be mobilized and sent to the surface of the cell, into the cell membrane. And then the glucose has a way of getting into the cell, being taken up by these glucose transporters and introduced and then released into the cell. Now, when you have, or somebody has, prediabetes or diabetes, or what we call insulin resistance, what happens is they make insulin, especially in the early phases. They actually have an increased amount of insulin. We test sometimes the insulin or surrogates for the amount of insulin that somebody produces, and we find an increased amount, and yet their blood sugar is high. So it seems like a paradox. They should have lower glucose if they have more insulin, right? Because they have more insulin to mobilize those glucose transporters and intake all this sugar into the cell. But the problem is their receptors, their cells don't respond appropriately to insulin anymore. And that's part of the mechanism behind developing diabetes. Well, to make this long story shorter, when we exercise, we know that on one hand, the insulin resistance is counteracted. Our cells become sensitive to insulin again. And that mechanism that was clogged is activated, it's primed again, and it works again. So that's one way it helps. But there is another one, rather fascinating, in which even if there is some degree of insulin resistance or insulin deficit in more advanced cases of diabetes, doing enough physical activity, and we're talking about 2.5 hours per week of aerobic exercise and at least 2 or maybe 3 sessions per week of at least 20-25 minutes of resistance training per week. If you do that and you have prediabetes or diabetes or insulin resistance, insulin makes it into the cell through a separate insulin-independent mechanism so that you can use that insulin even if you don't have enough insulin or your insulin activity is impaired. And that, my friend, is another reason why you and I should exercise regularly. I hope that inspired you. You stay healthy and you stay active, my friend. And I'll see you again tomorrow.